A very good morning to you. How are you doing? I hope that you're well, you're fine, you're blessed in the Lord. Karibu, karibu, karibu sana. I'm very happy to have you here. Thank you so much for choosing to watch MBCI TV. Hapa ni ambapo tunabadilisha maisha by the grace of God. And I'm very excited and blessed to be here. My name is Rachel Kahogo. And today we'll be having such an amazing conversation. Because as I told you before, is that this month is Breast Cancer Awareness Month. And today we're not only talking about breast cancer from a doctor's perspective, we are doing something else that is a bit different, and we'll be telling you about it as we get into the topic of discussion. But karibu sana, we are happy to have you here. We'll be here up to 10 in the AM, and I know that today we'll really get blessed. Karibu. Now, our numbers are very open. We'd love to hear from you to know how your week has been so far, what you're thanking God for, and you know, where you're watching us from. No, not watch na kina nani. And for that, our numbers are very open. That is 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and on all social media pages at Rachel Kahogo. I'll be able to get your feedback, and I'll be happy to hear from you. And today we're starting on a very high note. Of course, at the end, we're going to be having a doctor who will help us unpack what exactly breast cancer is. But what we'll be starting by is hope to everyone who's just fully received diagnosis for breast cancer, or you know someone who has breast cancer. And this is because today in studio we are having Veronica Nduta. And Veronica is a breast cancer survivor. How beautiful is that? To have someone in studio who will give you hope and tell you that unaweza kuwa leo diagnosed with breast cancer, but doesn't mean that that's a death sentence. Is that if you get treatment and get treatment very well, you're able to survive and live a very normal, amazing life. And she's quite a lot. She has a lot of heart, and just having this conversation with you will give you so much hope. But even as we do that, I'd love for you to just know who she is in details before we get into this discussion. And for that, we have the guest profile. Hello and welcome to Afya Clinic. Today, we are diving into a powerful conversation on breast cancer, one that speaks of courage, faith, and victory. Joining me is Veronica Nduta, a true warrior and a breast cancer survivor. Her journey began in April 2019 when she was diagnosed with breast cancer. But through strength, faith, and resilience, she overcame it and was declared cancer-free in February 2020. Beyond her inspiring story, Veronica is also a creative who expresses herself through beautiful beadwork, and she's also a gospel DJ, using her platform to share messages of hope, joy, and faith in God. Her life reminds us that with courage and belief, healing is possible. So welcome with me on set, Veronica Nduta. I'm your host, Rachel Kahogo. Good. Now that is who Veronica is. Karibu sana. Uko aje?
Niko poa.
You know, when you mentioned that you're a DJ, it really melted my heart because I love music. I really love music. And we'll be talking about that because you've said at some point you mentioned that you make beads as well. It's a lot of things. But because you're here, I'd want for you to, you know, introduce yourself. Uambie exactly what you do, everything that you do, wasalimie so that they can hear your voice, and then we'll get started.
So my name is Veronica Nduta Mwangi, and I am a general artist. I am a beader. I do beadwork a lot. I am a gospel DJ, to be specific. I was born in a music family. I would say that. My dad loved music a lot. And so I grew up in music. And in my growing, I realized that the love that I have for music, I can go and study DJ. And yes, I'm a gospel DJ. Yeah.
I love that. Why beading also? Because you've said you also bead.
Okay, my mom used to sell beaded artifacts, the earrings and stuff when I was young. So I was interested. You see what your mom is doing, what your daddy, you're following up. And so I got interested. And as I grew up, I realized I knew more than her. And so that was, after school, I would say after school, I wasn't that lucky to go to uni. So I had to look for a business. And what else to do than what I know, the beadwork.
Amazing. You know, you showed me one of the beadworks that you'd actually make. and that is very beautiful. Maybe we'll just attach it here as you continue the conversation, so that if you want, you can order. Okay? Tutaplug to your biashara hapo shamelessly. But thank you so much for being with us today.
Thank you too.
And since this month we're talking about breast cancer, October is Breast Cancer Awareness Month.
Yes.
We're very happy that we're not only having doctors who are speaking about breast cancer, we are also having you who is a survivor. Yeah. And in 1 year from diagnosis to being cleared of cancer, that's good news. Yeah. But let's start from the very beginning. When was the first time you realized that my breast is not normal?
Okay, I used to have this tiny lump on my breast, which was on and off, on and off. And then one day, it just grew big. I wasn't that sensitive, but it also brought a lymph node. And I was feeling a lymph node and a lump which is disappearing and appearing. And then at a time, it grew big. It was in April 2019. And so I was concerned. I decided to go, and I was hit by a door. I had forgotten that. I was hit by a door, and I developed a wound. And so it busted. Obviously, you will seek
medical advice.
When I went, I was told this is not a normal wound. You will have to be checked, because according to the lump and the lymph node, you could be having cancer. Yeah.
Okay. So what was the checkup like? Did they, because that's what membiwa, this is not normal, you need to get checked.
Okay.
Did you have thoughts that, what if this is actually cancer? So what happens if this is cancer?
Okay, to me, I couldn't think about cancer much, but I had instincts, because in my genetics, there's a lot of cancer in our family, in both families. So I was like, maybe it is, but not me. Not
it
me.
Can't be.
Not me.
Yeah. Sad. Now, at what point did the diagnosis now come back? After umepeleka tests, umeenda test sasa?
Okay, nilianza na ultrasound, wakaona kuna mass.
Okay.
And so I was advised niende niangalie, nifanywe biopsy. So that wanaweza angalia scientifically. Sasa unajua ile ni picha?
Yeah.
Hii sasa ndio waangalie, wapime vizuri, wajue ni nini. And so results zikakuja breast cancer stage 3B+. It was advancing.
Okay.
Yeah.
What's the difference? It's B+? So why B+?
B+ means that it's advancing to 4.
Yeah.
Ina grow. So inaendelea kutembea kwa mwili. Mine ilikuwa inaenda sana. Yeah.
Okay. And how comes, weren't you feeling any pain?
No. The funniest thing with that lump, it's painless.
Okay.
So akili yako hata sana itafikiri uende diagnosis. It's painless. Most of the cases inakuanga painless until it grows. Maybe ifike stage 3 hapo ndio unaanza kusikia ni like something is off.
Okay. Yeah. Okay. So at this point, your advice to anyone would be, ukifeel kuna lump yenye ni abnormal.
Ukisikia kuna lump abnormal ama nipple yako imechange, as in your nipple is not normal. Unajua kama demu unajijua. Your nipple is not normal ama ime-invert. Because mine was inverted, nilikuwa na ignore tu. Yeah.
Okay. All right. Now, at this point, we may realize, and I know that later we'll be having a doctor and we'll be able to talk about stage 1, stage 2, stage 3, and what that looks like.
Yeah.
But at this point, umepata sasa diagnosis. Umeambiwa this is stage 3, B+, going to stage 4. So what happens?
Now, at first nikiambiwa I was off. Like, you are in acceptance and denial. But at least me nime-raise your faith. So I was like, God umenipatia test. Tuende nayo. You get? And so I was told you will start with chemotherapy. 18 sessions, and then you'll go to radio. As in my report, the funniest thing with my report iliandikwa yote, day 1.
Oh, okay.
So like, I knew everything, but I was clueless. What is radio? What is chemo? Like, so before ni explain you, nilikuwa nimeanza treatment, because nilikuwa naambiwa hii nini yako inaenda fast.
Lazima
inaenda fast. So you need to uanze treatment haraka. Ndio tuweze kuikab. Yeah.
Okay. But maybe before tatufika hapo, what was your reaction after you've sat down with it, na sasa imekuhit that this is cancer I'm dealing with? As much as I'm a believer, and that's a very important part. Yeah. Now you know that you have cancer and life has to change, of course. Yeah.
first I cried. I cried, I think a half an hour, and I was asking God, why me? Ulizunguka tu ukaniona mimi. And then I remember I was with my mom and she talked to me, she encouraged me. And nikakaa ni kama nimekubali, you know.
Yeah.
But sasa news yenye ilini break because they told me kila kitu mwanzo. They will take off my breast. Why? That was hard. Because like nitakuwa ninatembea, unajua at first you're not told about prosthesis and all stuff.
Yeah.
So I'm like nitachange nikaa mwanaume sama.
Yeah.
And you know kunaenda news napeangu, you don't process it as venye umepewa. My thoughts were nitakuwa flat. You get?
Yeah.
And now I'm not married. Sina mtu.
Yeah.
Kitu maana.
Yeah.
But with time I came to process and accept. Because now it is what it is.
Yeah.
You'll have to start somewhere.
Yeah.
Yeah.
Okay. And now you start your treatment. What is the treatment yenye ulianza nayo?
Nilianza na chemotherapy. Session ya kwanza ilikuwa mzuri. Session ya pili, there was a lady who was preparing me because sasa sijaambia maneno ya nywele itaanguka, kucha zitakuwa grand, all stuff. But ikifika ya tatu, I was somewhere working. Nikishika nywele, ikatoka. And so I had to shave it all. But kwanza nilijidanganya nikashave box. Like I loved box. In case I was to be shaved, nini box.
Yeah.
But in the morning I was hairless. You know?
Yeah.
As a lady, that changes your life. As a lady, that changes your looks. It changes watu wataniona aje.
Yeah.
And then the baldness, see ile bald ya kawaida you have, at least you have balls of hair. Unakuwa flat kabisa.
Like bald.
But mpaka nilinotice I have niko na ka vein kwa kichwa, like it's bald, no hair anywhere.
Yeah.
And I was like, how will I face people? How will my life be?
Yeah, I can imagine. Now, at this point, need about what the second, third session of chemotherapy?
Of chemotherapy.
Okay.
Now my body has started changing. I'm starting to be black.
Yeah.
You know, I'm not, naturally, I'm not dark. So I start to be dark. I'm slimming because with chemo, I wasn't eating. Like anytime I get chemo, I'm puking, I'm eating and
you're throwing up.
I'm throwing up, I'm diarrheaing. My body is not the same. And now I'm starting to look funny.
Yeah.
And I'm seeing people looking at me funny. But I was still encouraging myself. I'm telling myself, this is a testimony in the making. I'll still hold on.
Yeah.
Yeah.
It actually is. And maybe this is just hope to everyone who's undergoing chemotherapy right now. It might look hard to them, and it is hard to them, really, and to the family as well.
Yeah.
But as we can tell from you right now, look at you looking so beautiful.
Thank you.
Is that there's hope. There's really hope. Yeah. So at this point, we can delay chemotherapy. The cancer is clearing.
Yeah. The lump is reducing.
Okay.
Because it's supposed to, like, if in your lump ipeleke mahali pamoja, so that they can be able to remove, because hiyo ndio iko na cancer cells you get. So kufika session, I think ni ya 4 hapo, 4-6. They told me that lump yako imecapsize, now you have to go for surgery. Sijamaliza chemo bado. So
ulikuwa na sessions ngapi za chemo?
I think 18.
18.
Yeah.
Okay. You're at what session?
I'm at the 4th na imecapsize. As in sasa hata imekuwa ndogo kushinda. My breast was, it was like double, ilikuwa kakimzigo. But sasa imereduce hata kushinda hii.
So it was just one breast that was affected?
It was one, the right one. So wakaniambia it's time we can remove it and then you go back to chemo.
Okay.
So that is when I went for surgery. Yeah.
So it was removed?
It was, the whole breast was removed. Okay. Because you see my cancer has advanced. Yeah.
Okay. Now, why did you have to go back to chemotherapy?
Now, with the removal, because they removed the breast and the lymph node, but they are not sure if the cells are
still there.
The cells could be still there.
Yeah.
So you have to finish the sessions first. Yeah.
So you finished the 18 sessions?
I finished the 18.
Okay.
And now it was time for radio.
Okay. Now, what's the difference between the radiotherapy and the chemotherapy?
Okay, the difference is that chemo is medicine. You are given medicine with the drips. It's dripped.
Yeah.
But now with radio, it's a machine. It's supposed to censor the part that has, you in a way, kill minor cells. So it censors the parts that the part that unaingishwa kwa mashini inachoma hizo minor cells just in case kama iko.
Yeah. Okay. So for how long did you go for the radiotherapy?
I went for 30 sessions.
30 sessions?
Yeah.
Okay. At this point, your chemotherapy and radiotherapy, how's your mental state?
I think I was strong.
Yeah.
Because my radio was done in Nairobi. I was alone. I was living in a hostel. So I used to take myself to hospital. So I had me, myself, and I. So I think that one encouraged me because I told God, my family has remained home to look for money for me. Because now I have to pay for the radio. Now I'm here with you.
Yeah.
I think I had, because of the, you know, when you're going through chemotherapy, you lose friends and you go through a lot. So I think I had so much strength because of me.
Okay.
I had to be with myself.
Yeah.
You get?
Okay.
Yeah.
Did you have people that you'd say stood with you? As much as you're saying that you lose friends, you lose people who are around you during the journey of chemotherapy and radiotherapy. Did you have people who stood with you and really gave you strength, apart from it's me and God dealing with this?
Yes. My mom, my doctors, my nurse who told me, this chemotherapy is taking you through losing your hair and all that stuff. But without that, we cannot know you're healing. So with that in my mind, I was like, so I'm going through this because I'm healing, not because I'm dying, as the world is saying.
Yeah.
And a couple of friends who still stayed, I think around 2 to 3, they encouraged me a lot. They told me, Vero, hold on, you're strong.
Yeah.
We have known you as a strong person, keep holding on. Yeah.
Okay. Why would you say that is important for anyone who's going through the cancer journey or the cancer healing journey, because it's a healing journey? Why would you say it's important for the circle of friends and family to really support them during this time?
Okay, cancer is tough.
Yeah.
But when you receive love, you know, cancer comes with a lot of messages in your head. Like some people say you're cursed and all stuff. But if you have friends who are encouraging you, you know you have something to hold on. If you have family that is supporting you, you know, if I have my family, it doesn't matter if my friends leave me. I have my family and I have to fight for them. So when they show you love, you know what love does. Love can help you encourage yourself and keep strong. But now when you're wamekuweka kando, you feel like, I think this is a punishment for me and all that stuff. I think I need to die and all that. But love will keep you holding on. You will say, because of Lani, let me keep on being strong. Yeah.
Okay. I hear you. Now, it's good that you're learning about breast cancer. And today we have a living testimony that breast cancer is not a death sentence. And you know, that's really beautiful to know. Because as you've said, is that the world makes it look like kama umepata diagnosis of breast cancer, it's time to say bye-bye. But it's not. There's hope. There's hope. And that is why we have a whole month dedicated to people speaking and advocating against, you know, breast cancer and telling people that it's not a death sentence, trying to gather finances because it's really expensive, as you've mentioned.
True.
Yeah, but we'd love to know what the people know about breast cancer. And now, because of that, we'll be getting to take a look at the Vox Pops, and then we'll be coming right back. Sinembali.
Breast cancer ni mtu tu anakujanga anajikuta tu ako nayo, na uwezi jua imekuja na nini, kwa sababu tuwezi sema ni chakula, tuwezi sema ni nini, mtu tu anajipatanga ashapata. Sasa after that ukishajua uko nayo, unaenda tu hospitali, unaenda unapimwa, alafu unaanza manini hizo test. Alafu sasa utapona tu. Kama uko stage 1, stage 2, stage 3 unaweza pona. Lakini stage 4 sijui uzuria, sijui inakuwa imefika mwisho.
About cancer, especially the breast cancer, anytime you feel something weird like a lump or change of skin, those might cause cancer. So unahitajika uende ili wa verify. Pia unajua hauwezi jijazia tu ni cancer. So unafaa uende hospitali ndio waeze rule out ni cancer na uanze matibabu. Pia mostly kama unanyonyesha kama saa hizi mimi nikiwa na mtoto mdogo hivi, ni inaweza kuwa high risk. So you need to be very cautious in everything yenye inakaa unusual. Yeah, redness kwa skin ya breast, pain, maybe you feel a lump, ama ka pimple, anything, just go to the hospital. Yes. Ndio ili uweze kusaidika na mapema.
Are caused by maybe a lot of stress, ama the lack of breastfeeding. And I think there's something inheritable. Yeah, you can inherit from the family.
Perfect. You're back, and that is what we get on the Vox Pops, and I'm really glad that especially during this time, the whole of October, we really talk about breast cancer this month. Itabidi tu mkubali. Yeah, I'm really glad that we get to understand what breast cancer is. And maybe this is where we ask, Veronica, before you got the diagnosis of breast cancer, did you ever have, did you know or have details that this is what breast cancer is, this is what it does to a person when you get breast cancer?
Actually, I'll be honest, I was clueless. Clueless. I used to hear cancer as a hearsay. You know, when you hear about diabetes and you don't have experience, I was just like that.
Yeah. And maybe that is why we need to talk about it more, so that everyone would know this is what breast cancer is, so that when someone has breast cancer, you're able to support them from not like an over there concept,
Yeah.
you know, so you're able to work with this person. And I would say probably that is why most of the friends even left. Not to justify them, that was very wrong, okay? But maybe just to say they didn't know what was happening.
Yeah.
They were very confused. Yeah. So maybe we need to do better there.
Yeah.
We really need to do
and
better
remind
there.
people cancer is not contagious. Yeah.
I love that.
I think some people live because they think utawaambukiza, like other sicknesses. Cancer is not contagious. Yeah.
Okay. Now, during your treatment, you've told us some of the changes that happened. Maybe let's just now talk about them. What are some of the most significant side effects of chemotherapy and radiotherapy that you experienced?
Okay, I experienced loss of hair.
For the loss of hair, did it happen was it a poly, or it was a span of like 2-3 days and it's gone?
Okay, it was after the third session.
Yeah.
I said the third session. So after the third session, your hair goes. But again, it will come back. It came back as a kid's hair. I had a supu hair.
Yeah.
I had a very beautiful hair. So it came back the first one. You shave, the second one you shave, and then your normal hair comes.
Okay.
So your hair returns.
Okay.
But now, what chemo does, it kills all your cells. All of them, the bad and the good.
Yeah.
So in short, you're walking cells-less. You have to survive by God's grace.
Yeah.
And so my nails grew gray, my skin was pale, I was slim, as in a lot happened.
Yeah. Okay. Did it change with the side effects? Did it change how you view life? Did it change your faith? How you relate with people? Did it change you in any way?
Okay. From the body perspective, the diet, obviously you change the diet. Most of the time you go natural. And so I came to realize that you need to eat well. And at some point I felt like maybe the mistake I did was not eating well. And the faith, it built my faith. Instead of killing it, it built, because now it's me and God. And I remember this day I told God, I know you gave me this because I know you can handle it, not me. You can handle it. You know the devil. I don't know the devil. If this is the devil's attack, you deal with him. I only know demons. And those ones I deal with them in prayer. So my faith grew. But now my life after cancer was never the same, because I view people differently. I treat people differently. I came to realize that disability is something that can happen anytime. Yep. You don't have to judge anyone. Because you can travel and maybe the car gets an accident and your leg is gone and you're disabled. Like don't judge people. I learned to love everyone the way they are.
I really love that. Well, you say that your faith grew stronger. That's so beautiful, because I understand as human beings, sometimes you go through a very tragic season, and your first thought is, by the God nikaonipendi, me I'm God.
I had that question time.
Me I'm God. Did you question? You feel
Yeah, there was a time I looked at there was this small stool at home. Nilivuta, as in nikaileta karibu. I told God, you need to come and sit here. Tell me why you gave me this. This one, I think it's bigger than me. I need you to talk to me. What happened? And a voice told me, don't question me. I don't do just things. I have a reason why you're here, and I have a reason why you're going through this. And this is a season.
Yeah. Okay. What advice would you give to, we'll talk to the cancer patients, to the people who are, going through the treatment, but to the people who are surrounding these people, to the friends, the family, the spouses, the children of these people who are going through cancer, any type of cancer really, what would you tell them?
Okay, show them love. First of all, show them love. Accept them the way they are. Cancer came. This is something you cannot change. It came. Now you have to deal with it. You have to pray for them. As in, the way they are, accept them the way they are, and don't judge them, because you don't know tomorrow. This is today. You don't know tomorrow. You might be there. So treat them well, love them, support them. Even in finances, don't think that they are using too much. They need it.
They need it. Cancer treatment is very expensive. It's very expensive. You've mentioned something about your diet. Let's go back there, kidogo. Every time we have doctors here, they tell us, eat well, balanced diet, take fruits, take a lot of water. Doctor patients will be telling us that in a very short while. Take a lot of water, take fruits, take... I pray that we'll be able to do that. You said that you didn't do very well with your diet during your treatment. What would you tell the cancer patients out there about diet? Okay,
what you're instructed to do it. I was instructed to go greens. I went greens a lot. And I went to the extent of eating boiled because I think I was stressed. I went fruits, water. As in, you avoid junk a lot. And I was told to stop sugar. Where I loved sugar. It was a hard one, but I had to. So whatever you're instructed by your nutritionist, you do it.
Okay. What's the major difference that you'd say you've seen before you had cancer and now after the treatment?
Okay, I learned to love myself more. Self-love. I was love others people, other a lot, and I loved myself a lot, and I became this person who will encourage people a lot. Even when I was sick, I used to encourage other sick people, like I wasn't there. So I became a caring person, and the one who would advise you a lot, even without training.
Okay. So this started, it went for around 1 year from diagnosis. Potato, depends with how people say that word. Nambi wango mara 15. From when you knew that you had cancer to the day you were declared cancer-free. So that was from, you said April 2019?
April 2019 to around February, March 2020.
Okay. How was the feeling the day that you went to hospital? Lokamba, this is the last day that you'll ever hear about cancer in your body.
I was told in the room, like, we are not seeing any traces. It was like a miracle because 3B plus is it's rare to heal. But one thing I kept on with was like, doctors treat, God heals. So I believed one day I will heal. And when they told me that you're cancer free, I got out. It was in the hospital. I got out of the room, of the doctor's room, and I screamed. I jumped and brought everyone's attention, but I didn't care. I am healed. Most of the time I used to go alone because I'm partially an introvert. So sipendi kwenda na watu. So like I screamed, and the funniest thing, as I was screaming, there was a lady who had cervical cancer, stage 4. She had healed.
Oh, wow.
So we were jumping outside there and enjoying. Healing is there in cancer.
I love it. Now, for the people who are battling cancer right now, what would you tell them?
It's a season. it's a testimony in the growing. And one day you'll give a testimony. Don't listen to the world.
Yeah.
Listen to God. God has given you a test and you will win it.
Amen.
Yeah.
Amen. You will win it. What is the major lesson that journey taught you?
Life is unpredictable. Anything can happen. And when it happens, it has happened. You can do nothing. Learn to live with it. Yeah.
Learn to live with it. Okay. Veronica, that has been such wholesome conversation. And I know that there are very many people who are listening to you right now, and they now know that actually God can heal, and that God is a miracle working God.
Yeah.
And I'm so glad that we've been able to have this conversation with you. And I pray that this will be a testimony, not only to a few people, but to everyone who's listening and they're battling cancer. I pray that God will heal you. And, you know, as you've said, is that cancer is not a death sentence. You can actually get healed. And now that we're talking about healing, I pray that you believe it in your heart. And even as you're going through this journey, please do not doubt God. That is my favorite part of your story, that you actually grew your faith.
Yeah.
But now your relationship with God is even stronger. Yeah? I actually love that. So for the people who would like to reach out to you, do you have a contact, especially for the bidding?
Yeah.
And of course, maybe to, you know, just for you to encourage them through their journey. Yeah.
My numbers are 0705 76 15 72.
Take it again.
0705 76 15 72.
Perfect.
Yeah.
Asante sana. So that has been it for the first part of Afya Clinic today. We've had Veronica. She is a breast cancer survivor, and it's very beautiful to hear her story. And this is just to tell you that breast cancer is not, you know, breast cancer is not a death sentence. Yeah. And now we'll be having this beautiful second part where we now talk about what exactly is breast cancer. Now, from a doctor's perspective, because now we've heard that it's possible for you to get healed. It's possible for you to get cured. But what are you supposed to do? Because you have doctors who help us go through the journey. I love that you mentioned that one of the most instrumental people in your journey were your nurses and your doctors.
Yeah.
Well, apart from your mom and some of your friends, were the medics. Yeah, and that is why we need to have this conversation with our medics. So we take a very short break and then we'll be coming right back. Usinde mbali.
MBCI Television, transforming life.
The kingdom is reigning, a trumpet sounding. The apostolic and the prophetic are converging. Prophet Tommy Arayomi.
So when he shows up in your life, the hope of glory.
And the Issachar movement welcome you to 2 days of apostolic and prophetic leadership school at the PCEA St. Andrews, Nairobi. Dates: Friday 31st October to Saturday 1st November. Time from 9 a.m. to 6 p.m. daily. Featuring God's anointed generals, Apostle Isi Igenegba, Reverend Julian Kula, Apostle Dennis Wambugu, and Reverend Lee Wambugu. See you at the PCEA St. Andrews, Nairobi on Friday 31st and Saturday 1st November.
River Mississippi inakaa kukua country gani?
Be careful, huh? Zambia. Zambia.
River Mississippi iko country gani?
Uganda.
Nataka unikamilishie methali. Haba na haba?
Ni pale.
Haba na haba?
Pale.
Nitolee tu sauti ya kichokono kidogo tu.
It's about to go down.
Rudia tena.
Biblia iko na vitabu ngapi?
62. 62.
Kuna hii inaitwa River Mississippi, iko kwa country fulani Afrika. River Mississippi inakaa kama iko country gani?
Ni kama ni Israel. Israel.
Welcome to the outpouring of the latter and former rain, happening from 11th to 15th November 2025, 9 a.m. to 5 p.m. daily at Uhuru Park, Nairobi, Kenya. Brought to you by the Africa Agenda Movement. Guest ministers: Bishop Noel Jones from the U.S., Dr. Cindy Trim from the U.S., Archbishop Harrison Nganga from Kenya, and Bishop Dunstan Maboya from Tanzania. Hosted by Prophet Stephen and Shala Kariuki. Music ministers: Eunice Njeri, Kestin Mbogo, Pastor Tumaini Akilimali, and Moji Shot Baba. Come and experience the word, healing, miracles, signs and wonders at the outpouring of the latter and former rain. Entry is absolutely free.
MBCI Television, transforming lives.
Right, we're back. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And this is Afya Clinic, where we talk about everything that concerns your health. And today we are talking about breast cancer again, because it's very important for you to know about breast cancer. And today we started on a very high note because we started with a breast cancer survivor. Yeah, and she told us about her journey. Well, she realized that she has breast cancer, what treatment was for her, and when she got to be declared cancer-free. Such an amazing story that gives you hope and shows you that breast cancer is not, a death sentence. Ukipatikana kwa na breast cancer or any other kind of cancer, it's important for you to know that you can get cured, you can get healed, because we have the doctors and we have God. Super amazing, right? And now we're back, and we are here with Dr. Patience Nungari, and she will be taking us through what exactly breast cancer is, what are you supposed to know about breast cancer. And we've had this conversation before, but it's very important for you to know about these again and again and again. One, because this is October, and October is Breast Cancer Awareness Month. But two, because it's very important for you to have this information. All right, now let's get into the guest profile. This will help you know who Dr. Patience is.
Hello and welcome to Afya Clinic. Today we are talking about breast cancer, shedding light on the journey of healing and the hope that comes with early detection and care. With me is Dr. Patience Nungari, a born-again doctor who views medicine not just as a career but also as a divine calling. She is passionate about giving hope to cancer patients and has served in several healthcare facilities, including Bahati Sub-County Hospital in Mailikumi, Nakuru. She's also a businesswoman and a worshipper. So help me welcome on set Dr. Patience Nungari. I'm your host, Rachel Kahugo.
Perfect. We are back, and we are here with Dr. Patience. Karibu sana.
Thank you.
How are you doing?
I'm well.
You're well?
Yes, I'm very well.
Amazing. Thank you so much for being here today again.
Thank you for having me on board.
It's so beautiful. The guest that we had before, I told her that she wears so many hats. And it's beautiful to have you here again because you also wear so many hats. The last time we were here with you on set on MBCI TV, you were here as a worshipper. Not today, you're here as a doctor.
See.
And it's very beautiful to have doctors who also believe in God, because they give hope, as we've heard from our guest before, that her doctors really helped her in the journey. But because you're here, please introduce yourself so that the people will hear your voice and tell them everything that you do.
Wow. So I'll say praise Jesus.
Amen.
Because I'm born again.
Yeah.
And my name is Patience Nungari. You just call me a doctor.
Yeah.
Because I am. And I thank God because of giving that gift to me.
Yeah.
He entrusted it to me. So I'm just born again, and I'm a healthcare professional.
Yeah.
And I believe that we will go on well.
Yeah.
Even as we take care of lives. And we'll prolong lives that are to be prolonged. Hatutakubali wakufe haraka.
Yeah.
And as we pray for them also,
Yeah.
we take care of them as we pray for them.
Yeah.
Because they go in handy.
Yeah.
Yeah. they work together.
Amazing. Amazing. Perfect. Now, there's a question I love to ask doctors before we start with this conversation. And today we are talking about breast cancer. We'll go in depth and talk about breast cancer. But before we do that, as a doctor in the line of duty, what is your most memorable time or day or situation or patient? Just as in the most memorable is a particular patient. Yeah, what was that for you?
I have a lot because I've encountered a lot of patients, those who are alive and those who went to be with the Lord. So there are those patients. I've encountered a lot of conditions. I've managed a lot of conditions, and there is a few patients who had diabetes. Na kuna kitu mnasikianga, allow me to mix my lugha. Yes. Kuna kitu mnasikianga inaitwa DKA, diabetic ketoacidosis. So that is an advanced form of diabetes. Imeshoot sana. So when I was early, ama nikuwa mchanga bado in the profession, I had that patient who had an advanced state of diabetic coma and acidosis. And he was in my hand. Unfortunately, he was a gentleman, not so old. He was very young, in his early 30s. So it was so hard to manage him. But with the help of those who are more experienced than I was, we tried to manage him, but his life was lying in our hands. And it was not easy seeing someone going dehydrated, going into shock, going into coma. Also other people, I had also other patients with cancer, whatever we are going to speak about today. And they were very severe. Other patients, kuna hizi traumatic road accidents.
Especially that.
And there is this point when you go to the wards and you're placed in the emergency room and you have to be there, unangoje ambulance, ilete patient ametoka kugonganishwa. And they have found a very tragic road accident. And they're there, amekuja bila mguu, amekuja bila mkono, ngine amekatwa into two. You have to stop the bleeding and try to save the remaining part of his life. Tuone kama anaweza kuwa survivor. And sometimes you go sleepless. You don't sleep over a week or two until the Lord is too merciful that you at least have one night's rest. You encounter a lot of things.
I can imagine. Have you ever had to go for therapy because of your profession?
We talk in my profession.
Unasikia
kitu inakusumbua, you just have to talk yourself out. To those who are higher than you, ama wenye mko on the same level. You talk to each other, you encourage each other. Usiku kama haulali, amsha tu mtu mpigie simu mwambie silali. Can I come at your place? Can we sleep together? Because it is so traumatic. Hadi uzoe peke yako.
So let me ask, maybe we will have, there's a time we'll have this discussion, but we've talked about mental health, sana. And I remember there's a doctor who's also happens to be my relative, who told me one time he was treating someone who was very close to him. And that's, this could be a very sensitive story, so I'm trying to be very sensitive with it as well. But it got to a point where he also almost got to depression because of, encountering this person, because their life ilikuwa like a feather, So I can only imagine how, mi nawaombea tu. Nawaombea jamani. And this is to everyone else who's out there and that are health professional. May God help you. Now, today we're talking about breast cancer. In layman's language, breast cancer ni nini?
Okay, in layman's, this is where normally, saizi vile we are healthy, our bodies have its own cells. Cells created by God, and cells that multiply themselves so that we can grow. So in layman's, cancer is whereby kunakuwa na development of abnormal cells then happen could develop kwa mwili or not can be entirely the whole body or even in blood because you hear of leukemia or even a part of the body hata kama ni kwa fingertip. So there is development of abnormal cells that come and form in that specific part of the body and are fighting the body cells so that they can occupy that place. Zinaweza kuwa kama lesion in that specific part of the body. So they are just abnormal cells that form and are counteracting the normal processes of the body or the normal development of cells of the body.
I hear you. So specifically for breast cancer, how does that present?
Okay, breast cancer, pia breast iko na cells. And both men and women have breasts. They only differ na different aspects. So in the breast kuna different cells also that make up the breast and make up the different parts of the breast kama the areolas, the nipples and the entire breast. So there can be development of those cancer cells in that specific part of the body. The breast is an organ by itself because iko upande wa nje. It is an external organ of the body. So there can be development of cancer cells which counteract with the cells that make up the breast. Na inaweza hibernate because the breast contains a lot of fat. It contains a lot of fat. And fat inaweza camouflage, inaweza feature the cells. And they develop slowly. And as they develop slowly, they multiply as they grow in a specific part of the breast. And following their development, zinaweza anza kuspread.
So is that why, maybe now it makes sense, is that why for breast cancer inaweza fika at a stage 3 without you knowing quite fast? Because like the guest Veronica that you had before, for her she got to know that she had cancer ikiwa stage 3B+. And at that point ni kwa sababu aligongwa na mlango akaenda kuangaliwa hosi and then she realized this is cancer. No, it makes sense why, as you've explained, is that kuna fat and ina feature cell, so cell ina grow tu pole pole without you knowing. Okay, I hear you. Now, how would you know that you have maybe cancerous cells in your breast? Or rather, what are the symptoms? Maybe that's the best way to put it.
Okay, there are a lot of symptoms, but zile major, when you look at yourself, or even when you go to when you go to the hospital, lazima utafanyiwa scans. Kuna kitu inaitwa mammogram, kuna ingine inaitwa MRI. Those are radiological scans to investigate on the extent of cancer spread in the breast. And you can also do something we call self-breast examination. Self-breast examination is where you check on yourself. Sana we encourage people who have breasts, that is both male and females, to check on themselves whether they can have signs and symptoms of breast. Unaweza kuwa na kitu kama lump kwa breast, ama tuseme kitu kama nodule, simply. A lump or a nodule when you examine yourself, and it is not something that umwaiona before in yourself. You can feel the lumps in you. Also, you can see the anatomy of the breast is starting to change. The structure of the breast is starting to change. Unapata maybe one of the breast is enlarging, enlarging. Lord, yes.
English.
Yes.
Bora melewa.
It is enlarging. It is enlarging than the other, or it is even becoming red and red. Ama unapata something like pores. You see, tunakwanga na zile skin pores za jasho, but unapata hizi ziko deeper and ziko more scattered and they are reddening. You see, and it is becoming more painful. The affected breast, it is becoming more painful. Also kuna hiyo part tunaita the areola or the nipple. Unaweza pata the nipple many times, the way God created us, the nipple should protrude outwards.
Yeah.
So unapata the nipple can be in a dimple.
Yeah.
Inarudi ndani. And then when you check on yourself, you start having discharges, kama pus from your nipple, or even blood, it can be coming out. Yeah, so those are some of the symptoms. You can be having the lumps, the reddening, the pain, the enlarging of the breast. Yeah.
Okay. And you've mentioned that this is for both men and women.
Yeah.
Yeah. Because as we said last time, is that we are so used to saying, breast cancer, women should go get checked, should go for the screening, and you forget to mention the men. Yeah. And that becomes a problem because then you realize that unfortunately for the men ambao wamekuwa diagnosed with breast cancer, wanapatanga ikiwa stage 3-4 kwa sababu they'll not imagine this could be breast cancer. So for men as well, please go get checked. It's very important for us to, if it's there, if you catch it early, the better. And we'll be talking about that. But what are some of the risk factors for breast cancer?
There are several. To begin with, kuna age. Sometimes it comes with age and advanced age. Ama tuseme midlife age. Naweza pata me and you, we are young. So our chances ziko low. So the chances increase with increase in age. Sana the patients or people who are above 50. People who are above 50 are highly susceptible to cancer. And they should wanastahili kufanya check-up sana. And self-examination ama hata waende kwa hospitali waangaliwe. If kumekuwa na family history of breast cancer, it is highly in a lead to vulnerability, ama high risk to obtain that because genes are shared and DNA is shared, so it can flow down from the family members. The family history can lead to contracting breast cancer.
Okay. You know why that makes sense now? Because the case that we had before, alisema alikuwa amesikia that is Veronica. But if you've missed, we're probably mentioning that and you've not watched. We're live on Facebook and YouTube. So ukirudi nyuma, utaona we started off with Veronica, who's a breast cancer survivor. And she mentioned that at first alikuwa amesikia breast cancer from both families. The people in their families, from the side of the dad and the mom, who had cancers before. So alikuwa amesikia tu in passing. But most probably, that could be why it trickled down to her. Again, as you mentioned, family history. Okay.
Also, we can have things like easy lifestyle issues. Vitu kama obesity. Tumesema obesity and issues of fat in the body. So when you have a lot of fat, it can harbor cancer cells. Yes. Things like smoking. Smoking automatically, that's a carcinogen. It carries a lot of risk with cancer. And also, hata kama besides being a carcinogen, smoking, kuna kitu inaitwa the feminine hormones. Wacha tuangalie on the female aspect, sababu sie breast wanajua sana ni ya female. Kuna hormone inaitwa estrogen. So when people smoke, the smoking habit diminish the level of estrogen that is being produced by the body, and the estrogen hormone is so helpful in taking good care of the breast and also the ovaries here, and also breast cancer can prompt someone to get CA ovary, cancer of the ovary. So smoking can lead to it because in a deprive estrogen, and the more that hormone is low in the body, it increases the risk of acquiring cancer. Also other things like alcoholism, peer, serve the same risk as smoking. Yes, and kuna vitu zingine very medically kama gene mutation. Kuna genes zinaitwa BRCA 1 and 2. So these genes Mungu alituumbia ndio ziweze kusuppress the chances of getting cancer.
Okay.
So unapata huwa zina mutate. Mutate ni kuchange.
Yeah.
So when they change, zinaacha lesion. And the lesion grows into cancer. Yeah, so kuna hizo gene mutations.
Okay.
But in normal life kuna hizi vitu tunaweza adjust.
Yeah.
Obesity unaweza fanya activity, physical activity, at least lose your weight. Usijiweke kwa risk. Smoking, alcoholism.
Please stop.
You cannot stop it at one time. Nimeacha leo, but unaweza adjust. You can adjust the level of alcoholism and smoking.
Yeah. In fact, we say just stop it entirely.
Yes.
And that is why we have, if it's an addiction, that's why we have places like rehabilitation centers that help you. Because, you know, really, it even messes with your judgments.
Yeah.
It has a lot of issues, by the way. So it's not only cancer, which is the worst, but also you might, you know, lose your relationship with Jesus. So please don't. Yeah, okay. But I get you. So it's very important for us to just make sure that you're taking care of yourself. We'll talk about diet. But before we talk about diet, because that's something that it's very important for us to talk about. We mentioned about the checkups for the women. I think for the men as well. How early should you start going for your checkups?
As early as you feel there is something abnormal with yourself, abnormal going on with you. Tumesema it is so important to check on yourself.
Yeah.
So ukianza check and then you feel kuna the lumps, ama unaona kuna some changes that are happening, and unasikia zizi hapana, haikuangi hivi. That very time you are being advised to go to your nearby facility and seek consultation and help. Usikie daktari anasema nini, and you can even be prompted to go and seek radiological investigation so that ijulikane where are you. Na ikijulikana we can detect the stage and it will be easy for us to, it can be remitted. See, the patient who was here, the survivor, by God's grace, amesema alikuwa declared on remission. Glory to Jesus. So when you detect it early enough, it is possible for remission to be declared. So as immediately you feel like there is something off.
Immediately.
Immediately.
Because we're so used, and the other time we also mentioned about that, we're so used to waiting mpaka time yenye it's too late ama unakimbizwa hospitali.
Yeah, and waiting is so dangerous because huwezi cancer advances, it goes like fire on the floor with dry papers. Sijui kama ni good example ama kwa shamba ya ngano tuseme basi. It goes very quickly. Na unajua hapa where the breast is, kuna very delicate organs. Ikisema ni kuspread, it will go to the heart and to the lungs. And you need the lungs to breathe. And you cannot live if you don't breathe. So immediately you detect there is, or you suspect there is something off, just go for checkups.
Okay.
Yeah.
Okay. Very important. Now, before we talk about why diet is important and what kind of diet you're supposed to eat if you're a cancer patient, let's take a look at healthy living. It helps us, and I know that most probably it will touch on that kidogo. Yeah. So this helps us just to know how to live a more healthy life, because that's very important. So let's get to take a look at healthy living.
Hello and welcome to Afya Clinic, your trusted health companion where we talk about ways to live a healthier and happier life. Today, we are focusing on a topic that affects millions of women and even some men around the world: breast cancer. Breast cancer is one of the most common types of cancers among women, but the good news is with early detection and awareness, it can be easily treated. So let's take a closer look at what causes it, how to detect it early, and the simple lifestyle choices changes that can make a big difference. Let's dive into causes and risk factors. While the exact causes of breast cancer isn't fully understood, doctors say it happens when cells in the breast begin to grow abnormally and form a lump or mass. Some of the key risk factors include 1. A family history of breast cancer. 2. Hormonal changes such as starting your period early or menopause later than usual. 3. Unhealthy lifestyle habits like lack of exercise, poor diet, smoking, and excessive alcohol use, and sometimes just age. The risk increases as one grows older. But remember, not everyone with these risks get breast cancer, and not everyone diagnosed has a clear risk factor. Early diagnosis saves lives. Early detection is the most powerful weapon we have. Every woman should know how her breasts normally look and feel. This makes it easier to notice any unusual changes like a lump or thickening in the breast or underarm area, changes in the shape or size of the breast, discharge from nipple that isn't breast milk, skin deepling, redness, or peeling around the nipple. If you notice any of these signs, don't panic, but visit a doctor immediately. Regular breast screens or mammograms can detect cancer early even before you feel any symptoms. Health experts recommend that women aged 40 and above go for mammograms at least once every year or 2, depending on advice from their doctor. Healthy lifestyle and prevention. There is no guaranteed way to prevent breast cancer, but you can reduce your risk with simple lifestyle choices. This can be done by eating a balanced diet rich in fruits, vegetables, and whole grains, exercising regularly at least 30 minutes a day, avoid smoking and limit alcohol, and maintain a healthy weight. If you've had a family history of breast cancer, talk to your doctor about genetic testing and preventive screening. To all our viewers, remember, breast cancer awareness isn't just for October. It's an everyday conversation we must keep alive. Check yourself regularly, support loved ones, and spread the message of hope and early detection. Because here at Afya Clinic, we believe your health is your greatest wealth.
All right, you're back, and that was such an amazing segment right there. I hope that you've been able to learn a thing or two, and of course, again, thank you so much for being here. It's such an amazing time to learn again about breast cancer, and I'm here with Dr. Patience. Once again, thank you so much for being here.
Thank you.
And earlier on, we had a breast cancer survivor, that is Veronica, and I know that you got to learn a thing or two about, breast cancer, what the treatment looks like, and why it's important for you to seek treatment as soon as you get to realize that something is wrong or something is off. Yeah, and of course, a bit later we'll be having Mombi, who will help us, go through what we've got to learn today since we started. What kind of diet are you supposed to eat as a human being in general? Not even because you're sick. What is the right kind of diet? Sisi watu wa sugars tukae side gani?
Watu wa sugars mkae kwa asali. It's natural.
Oh yeah. Yeah.
Yes,
Okay.
Yeah, refined.
Yeah.
But matters diet. Tunakuanga na carbohydrates, proteins, vitamins.
Yeah.
Vitamins entailing fruits and vegetables. So medically, and actually vi hata ndo inastahili kukua, you are supposed to take, acha niwafunze.
Yeah.
Unaona, when you place your two hands like this, this is like a whole bowl. This is how much
Like
vegetables you are supposed to eat.
This much vegetables?
Yes.
Okay.
This much. And you are supposed to eat this much carbohydrates, this much, like 1 hand carbohydrate, this much proteins,
okay,
and fat this much, like this top part of your thumb.
Oh, Evie.
Yes, kama mafuta kadogo.
Okay.
You know, some of us. Yes, this much. That will be very healthy for you. Na itakuweka mbali na other many risks.
That's a very amazing and simple way to explain. So this much vegetables?
Yes, a lot of vegetables.
And then this much
carbohydrates. This much
proteins, and then this much
this
fat.
much fat and
Jana
oil.
try kuilearn kwa sababu najua Mombi akikuja ataniuliza. So I have to learn.
Yeah, please do.
Okay, so
cramming power.
Vegetables.
Yes.
This much. carbohydrates this much, proteins this much, and fat kadogo hivi, like this top part. You see, like kadogo hivi, only these.
Yes.
That part of fat.
Yeah.
Okay, I hear you.
A lot of water. You have to take a lot of water.
Yeah.
It nourishes the body, prevents us from dehydration.
Yeah.
Pia inatusaidia to prevent from some kidney issues. So mnasikianga some things like kidney stones. So it helps to wash. Ni kama to rinse. Yes, every now and then.
Okay.
So good diet for a cancer patient. Cancer patients many times wanakuwa very weak. So they need energy. They have to take carbohydrates.
Yeah.
Enough carbohydrates. Vitu kama mkate. They have to take a lot of carbs, ugali, mkate, some rice. They need that energy to walk. You see, even some of them wanakuwa they are unable to walk.
Yeah.
So they have to take a lot of energy-giving foods. They have to take proteins. Proteins ni bodybuilding foods. And you find many times, if you've seen cancer patients, they lose a lot of weight.
Yeah.
They grow very thin. So they have to take a lot of protein.
Yeah.
Sana white proteins could do them well. White meat, like poultry, kuku, mayai. Mayai, they should take it sana.
Yeah.
So that wasi lose weight. Sana.
Okay.
Also beans. The beans and easy cereals, they are very important for their health.
Okay.
Because beans, okay, people think that beans are proteins, but it has some percentage of proteins and also it has percentage of carbohydrates.
Okay.
So it has both and it is
That's
very
good.
healthy.
Yeah.
So they should take a lot of cereals like beans and hizo ndengu. They should take a lot of fruits. Meza yao inastahili kuwa imejaa kandoo kama tunda.
Yeah.
Sana machungwa and bananas, they could do them some good wealthy health.
Yeah.
Itawafanyia vizuri sana. A lot of fruits they should take. Vegetables, as we have said.
Yeah.
Hata kama ni mchemsho, they should chemsha managu and these natural vegetables.
Yeah.
Okay, wanaweza include akina sukuma and spinach, but they should do a lot of grains. If cabbages, I've had encounter with patients and I've been encouraging them to take ikiwa salads.
Okay.
Because it has natural vitamins in it. Haiko haijauliwa na joto.
Yeah. As long as it's well prepared and washed.
Yes, clean vegetables and clean fruits.
Yeah.
To add on that, to prevent dehydration, vile tu tumesema sahi, they should take a lot of water.
Yeah.
A lot of it. At least 6 glasses or 8 at least. Kuendelea.
Okay.
They need to sweat, they need to be rehydrated. Ngozi yao isikauke. Because the cancer cells are so active na hazilali, they are there fighting against other cells in the body. So they should take a lot of water.
Okay. You know, I had never seen it in this way when Veronica said that while you're going through chemotherapy, it kills your good cells as it kills the cancer cells. So you're working without the cells. Yeah? So when you've mentioned that you have to take a lot of water so that, you know, your body inaendelee ikiwa sawa, that's really because while you're going through chemotherapy, you know, it's very sad. Good thing you're healing. Yeah, that's the thing, you're healing because the cancer cells are dying. But it's sad that the good cells are dying as well. So I'm really hoping maybe as you continue, we'll get our way that we'll be able to maybe kill the cancer cells as the good cells zinabaki. Maybe.
Ichague.
Yeah, ichague. What was science and technology? Please, maybe let's come up with something close to that. But so far so good because you've seen a lot of survivors and that's good news. All right, now, what's the difference between a mammogram? You've mentioned in passing and you had it from Veronica as well. What's the difference between a mammogram and, you know, self-examination?
To begin with, a mammogram ni kitu unafanya kwa hospitali in a hospital based center. Na ni kama it is a radiological exam or investigation.
Yeah.
Ni kama x-ray. I think umefanya x-ray ama umeona kama hujaifanya.
Yeah.
It is exposed, but we also call a mammogram a low dose x-ray. So when you do an x-ray, you expose even the inner parts, kama the ribs, the heart, the lungs, and so forth.
Okay.
So a mammogram is a low dose x-ray, only targeting that tissue, like the breast tissue. Sasa the mammary glands mammogram, ina target the breast tissue.
Okay.
Na ina expose every layer of the breast to see what is off in the breast, to see what is abnormal, to look for any anomaly in the breast.
Okay.
And it helps to detect, unaona hata kale kalamp kenye ufeel, because there are this, vile tumesema, you can feel the lumps on the breast.
Yeah.
Na kuna zile wezi feel because inaweza kuwa ndani. So it can help detect. Na hata kama inaweza kuwa, kuna cancer tunaita benign, na kuna cancer tunaita malignant. Na inaweza, the benign can be a mass. So the cancer cannot, kuna uwezekano ikose kuwa mass, ikwe something flat.
Okay.
So it can help detect that thing that you cannot touch. It can be flat inside.
Okay.
So it helps kupitia to the details of the breast and see the hidden part, the hidden cancer in the breast. On the other hand, self-breast exam is something you do. There is a procedure you use to examine yourself. That is why it is self-breast exam.
Okay.
You don't have to call someone, kuja uniangalie nione. You check on yourself and see whether kuna si unaelewa tonsils. So kunaweza kuwa na hizi lymph nodes za kwa makwapa. Zinaanza kukua na tonsils kama zile za huku in layman's. So anaanza kukua na pain ya tonsils, you feel there must be something off. Maybe ni mkono inauma, or it is something pertaining the breast. So on self-breast exam, unaangalia hizo vitu tulikuwa tumetaja previously. The lumps, you check on yourself kama kuna lumps. And many times, you find that this lump you find on the breast, they are not painful. Ni kitu tu kama pimple inside, iko ndani. Inaweza kosa kuwa outward. So when you palpate, when you feel yourself, ndo unaweza feel there is a lump that is inside. Na yenyewe si chungu. It is not painful, and it can be one or more.
Okay, so it's more of just rubbing through your breast.
Yes.
Okay.
And you can rub it severally. Kwanza you feel it from the top. Unaanzianga, because the breast, for all of us, ladies and gents, it is tuseme ni round. So you start round from the outward. Tunasema the root of the breast. You start from outward as you come inside. Hadi ufike pale on the tip, on the nipple. Pole pole tu. And then you repeat the process. Ukifinya ndani kidogo. Ufeel ni nini inaweza kuwa ndani. And when you go round, you feel maybe there is a lump or there is no lump. You repeat for the third time deeply sasa. Finya ndani. Sasa hiyo ya kufinya deeply, you can feel maybe painful sensation on the breast. Or maybe if there is a larger lump inside, inaweza kusaidia kufeel.
Okay.
Yes.
Okay.
And also kuangalia, hiyo ni kuguza. Kuangalia, you can look at those pores zenye tulikuwa tumesema. Zinaweza kaa kama zile pores zinakuanga kwa ngozi ya machungwa. They look like that. And also uangalie the nipple very well, kama iko inverted, and even if it is discharging a pus or blood. Yes.
Okay. Okay. Perfect. Now with that, I know that we all know how to do self-examination. Now, let's take a look at the mythbusters, because we need to know, now that we've talked about breast cancer, what are some of the myths that surround, breast cancer? Is there anything that we need to demystify? Yeah? Let's take a look. All right, on the very first myth buster today is that breast cancer always requires mastectomy. Is it true?
No.
No?
Not always.
Yeah, yeah, not always, but sometimes it does.
Yeah, sometimes.
Yeah, maybe let's start with explanation of what mastectomy is for the people who are hearing that for the first time.
Mastectomy is the removal of the affected breast.
Yeah.
So that happens only when the cancer is advanced. Now the reason behind that is to prevent spread of that cancer to other body organs or to other body parts.
Okay.
So it is just removal of that affected breast and tissues surrounding that breast zenye zinaweza kuwa zimepata the cancer cells zimekuwa infected.
All right.
Yeah.
On the second one, is that breast cancer always recurs after treatment? Always. Tasisi wote tunajua shwali. Always?
Not always.
But then it's maybe important for us to talk about sometimes it does.
Yes. Sometimes it does because after mastectomy, there can be left a tissue yenye ilikuwa kwa hiyo area na ilikuwa already affected na cancer cells na haijatolewa.
Yeah.
So hiyo cancer cells zina grow na tumesema they grow very fast. Ni kama zinashindana.
Yeah.
So they grow very fast. Na if left even one cell, it replicates.
Okay.
And it affects others. It affects others, other parts of the bodies, including the skin affected, going inside.
Okay.
Yeah.
Okay. On the third one, is that breast size affects cancer risk?
No.
Not really?
Maumbile.
Yeah.
Yeah.
Okay. If cancer doesn't run in your family, then you're safe. We've talked about the risk factors. And, you've mentioned something with obesity. Yeah. So obesity really is not about your family. So you can tell that that's a myth. Yeah. The other one is that you can't live a normal life after breast cancer. That we've seen with our guest, the first guest that you had, Veronica. She's living a normal life. So that's a myth. So if you're there and you're battling cancer, it's good for you to know that you will get well. And after you get well, you will live a normal life. Sindio?
Yeah.
And the last one for today is that breast cancer spreads when exposed to air during surgery.
Pure lies.
Yeah.
Yeah, it does not. Cancer is not contagious. Cancer is inward.
Yeah.
Na inadili na cells za mtu binafsi. Yeah, it cannot see homa.
Yeah.
Yeah, it does not spread through the air.
Yeah. Okay. Perfect. So that is it about the Mythbusters that we've had today. But from the conversation that we've had, which I would say has been very, very wholesome, what would be your parting shot?
Yeah, my parting shot. First, if you feel anything is off, anything is suspicious, please seek consultation.
Yeah.
Just seek consultation.
Yep.
Na chenye daktari anakwambia adhia. Adhia by it na utasaidika. If it is advanced, just pray to God as you seek medical advice, further medical advice and medical management. Kama utaambiwa you need to remove a lump from your breast, that will save you a lot from the spread. Maybe inaweza kuja ikue malignant, iweze kuspread. So just adhere by whatever the doctor is telling you.
Yeah.
And also live healthy lives. Have healthy diet. Easy funny exposures to cigarette smoking, tobacco smoking, ata bangi. Bora ni smoking. And alcoholism. If you know someone, just tell them wacha.
Yeah.
Inaletanga cancer, na si cancer ya breast peke yake. Cancers ni mingi. You find even men can be smoking ikose kukamata breast cancer. Ipeleke kwa prostate cancer. Or any other cancer of the lungs. It is very rampant. So funny lifestyle, just stop. Be physically active. Engage sana sana in physical activities. Fanya PE, kimbia hata kama si lazima ukimbie, just walk a distance. Si lazima upande bodaboda ukienda soko na kurudi. You can walk to there and back. Yes, and lastly, just be prayerful. Na waambie Mungu akuprotect because he is the giver of health and he says in his word that good health is food to the child of God. So
I love that.
That one.
I love that. Perfect. That has been so wholesome. And today it has been more of giving hope to the people who are battling cancer. And this is not only breast cancer, but also any type of cancer. So if you're there and you're battling cancer, this is hope for you that it's not a death sentence. You can always get help, but also take care of yourself. We've mentioned about diet, what you're supposed to eat. Very, very important. Okay? Now, for the people who would want to reach out, maybe for clarification and, you know, to get help, do you have a contact that you'd share?
Let me do. It is 0701 56 7223.
Okay, take it again.
0701 56 7223.
Perfect. Asante sana. That has been super amazing.
Thank you.
We've had Dr. Patience, and before you had Veronica, who was a cancer survivor, breast cancer survivor. And now I'd love for us to have Mumbi on set, and you know, she'll be taking us through the whole conversation that we've had today, just for you to be able to know if you've missed something, and you know, just to catch up. But of course, we've been live on Facebook, we've been live on YouTube, and that would really help with, you know, you catching up on everything that we've had on today's conversation. But before we do that, let's get the Did You Know segment. So this is to jog our minds kidogo. This will help us know, you know, we've had a very engaging conversation. Now here, you jog your minds a little bit, yeah? So did you know that you actually see your nose all the time? Your brain just ignores it. Oh really? No, I'm trying to see if I actually see my nose. Did you know that you actually see your nose all the time? Your brain just ignores it. Are you all trying to see if you actually see your nose? Yeah? Did you know that you actually see your nose all the time? Your brain just chooses this. Because I can imagine if we didn't ignore it. Perfect. Thank you so much for it today. You look amazing.
Thank you. You look amazing too.
Thank you.
Yeah.
Perfect. Please introduce yourself.
Good morning, everyone. My name is Mombi Karaoke, and welcome to this segment where we do a bit of recap on what we've talked about, of empathy, just to drive the point home. Yeah.
Perfect. Now, we're doing breast cancer again.
Yes.
And this is because this month is Breast Cancer Awareness Month.
Pink October.
Yeah, Pink October. And we started with Veronica, who's a breast cancer survivor.
Yes.
Which was really amazing just to hear her story. And it was less than an year from when she was first diagnosed. Say that word.
Diagnosed.
Okay. Also say it at home. So when I say it, also say it. With breast cancer. Until to the... when she was declared free of breast cancer. And an amazing story. Just to, you know, maybe tell everyone else that it's possible for you to, you know, heal.
Yeah,
or get
to give
cured.
people hope.
Yeah, to give people hope. Those who are struggling with cancer, and not only breast cancer, but any type of cancer.
Any type of cancer.
Yeah, it's really amazing. Now take us through what we've learned today.
Yes, so we're going to start with breast cancer, you know, just the definition. So, and how it's caused. So it occurs when breast cells grow uncontrollably, forcing a lump or mass, forming a lump or a mass. So that's basically what breast cancer is. It's a lump that forms in your breast when your cells grow uncontrollably. And it could grow anywhere else, not just the breast. This is the basic definition of cancer. Yes. So another important thing that we learned today is that the risk factors of breast cancer include age, family history, obesity, alcohol use, radiation exposure, and hormonal changes.
Yeah.
And the hormonal changes part really stuck out to me because what do you mean when you start your period too early?
I know.
You know, and last time we talked about having the biggest risk of breast cancer is just being a woman. You know, being a woman already predisposes you to having breast cancer.
Yeah.
So that
because of the hormones.
Because of the hormones.
Yeah.
Yes. So
Again, to be a woman.
Yeah. So yeah, we should really take care of our health, being health conscious.
Yeah.
Again, I like to say that afya yako ni wajibu wako. No one is going to force you to eat healthy. You have to decide. No one is going to force you to work out and stay away from sugary things. You have to decide. Yeah.
By yourself.
You have to decide.
Speak to me directly.
I'm not saying anyone, but you at home have to decide.
You have to decide. Okay?
Yes, to live a healthy lifestyle.
I don't like when people are looking at me suspiciously. I was changed woman, by the way. Nowadays, I'm really trying to eat. You know, as we've always said here, not making it look like I don't eat healthy. I do.
But?
I do.
There's no but.
There's no but. I do. I do.
Okay.
Yeah.
Let me believe you.
Please.
Yes.
And
so, another thing that we learned are the symptoms of breast cancer. The symptoms include lump in the breast, change in size or shape, nipple discharge, dimpling of skin or pain, sometimes even reddening of the skin. So, and I like to say that these symptoms are not like a checklist where you say, I have a lump, but I don't have discharge, so it's not cancer. Yes.
Yeah.
So if you have one symptom,
go get checked.
Go get checked.
Yeah.
You'd rather go get checked and they find nothing.
But still,
go get checked.
That's the tagline.
Yes.
Yeah.
And we were also taught about knowing you're normal, you know, so that when something is abnormal, you know, and you are able to seek help in time. So it's not that you go to the hospital and they tell you, oh my God, have you been leaving?
Yeah.
You know, doctors really get shocked when people go to the hospitals and they're chronically ill. And they're like, how are you staying at home?
What do you mean?
Yes.
Yeah.
Yeah, so another important thing that we learned today is that prevention measures are regular screening, healthy diet, exercise, limiting alcohol, and self-examination. Yeah, so we've been taught about drug abuse. You know, if you know anyone around you who is indulging, you talk to them, you tell them, these are the risks. Yes, you could get so many other diseases. You should exercise. You should eat healthy. Be yes. Isn't it?
Now you're looking at me like.
No, I feel like unajitetea, but okay, continue.
I think it's easier said than done.
I feel like in an African setting, it's very easy to eat healthy because healthy foods are very affordable. Actually, they're cheaper than the unhealthy foods. So living unhealthy is a choice.
Yeah,
in this specific setting. Yes, because you can literally buy a banana for 5 shillings.
Yeah.
Imagine.
Yeah.
So if you choose to leave the banana and go for something else that is unhealthy, see, it's a choice.
It's a choice.
It's an even more expensive choice financially. Yes.
Yeah, it is. Correct. Correct. Next.
Yeah, I'm not just talking to you, I'm talking to everyone else at home. Live healthy. Yeah.
I feel like today's show is very personal, especially this last part.
It's not personal. We care about you.
Okay. Not you saying that after you had food poisoning the other day.
I didn't have food poisoning. Okay, so let's talk about the treatment options.
Oh no, it wasn't you.
Yeah. So
okay.
The treatment options are surgery, radiation therapy, chemotherapy, hormone therapy, or targeted therapy, depending on the stage. This is why you should go get checked early, because when you go get checked early, the treatment options are less intense. Yes, we've been told, like, for example, when you're going through chemotherapy, it not only attacks the cancer cells, but also other cells in your body.
True.
This is something, if it were caught early, you'd have done a simple surgery,
and
know,
you'd be good to go.
And you'd be good to go.
Yeah.
So if you have any of these symptoms, go get checked.
Please.
Yes.
Okay.
Yeah, we also learned about, just healthy living in general.
Yeah.
This is like the mother of all. And not just for cancer, also other things. Yeah, so let's choose to live healthy lives. Eat well, stay active, rest enough, and take care of your body, because good health is the foundation of a happy life. Yes.
Good health is the foundation of a happy life.
Yeah.
Perfect. So that has been it. Thank you so much for tuning in today. You've had such a good time and you've learned a lot about breast cancer. So I really hope that you've gotten to learn something. And I hope that this show won't be, just a show that you get to here on a Wednesday morning and that's it. It's something that you'll really learn and move with, especially the diet part.
Yes.
It's very important.
And the exercise.
Knowledge and exercise. Knowledge is power. Okay? Thank you so much for tuning in today. Today being a Wednesday, it means that we'll be having our lunch hours from 12:30 to 2:30. So do not miss out. I know that you get blessed. God bless you. Do have an amazing rest of the day and the week as well. We'll see you next week on Wednesday. My name is Rachel Kahugo.
And my name is Mombe Kariuki. Stay safe and take care of your health. Bye.
Bye-bye.
Jesus Christ.